Welcome to the PsyD Webinar. I'm Bradley Cypher, and I'm the doctoral advisor here at Divine Mercy University for admissions. Today, I'm joined by William Johnston, who is a current fifth-year student in our PsyD program here at Divine Mercy. In terms of the format for today, as always, I'll begin by asking William some questions about his experience here at Divine Mercy and his, how he got interested in psychology and his outlook looking forward as a budding clinical psychologist. And after that, we're going to dive into the PowerPoint presentation to give you a nice overview of the program itself, hit on the major points for the admissions process as well, and then finish with some Q&A. So as we go through this, please lodge your questions for William or myself in the chat box, and we will field your questions at the end of the presentation. So without further ado, let's get right into it. First, welcome, William.
Hi, thank you for having me.
My pleasure. So William, let's begin with, how did you become interested in clinical psychology?
Sure. Yeah, so long story short, I was actually serving on active duty service in the United States Army, and I was fortunate to have had psychologists supporting the operations we were conducting within the intelligence community. And I remember that they brought this incredible wealth of knowledge to the table related to the individuals we were working with and what we were trying to accomplish. And after discussing their experience in the field of psychology, I recall thinking that I wanted to be just like them and have that wealth of knowledge at my disposal. And so after the Army, I decided to go back to school. And when I was originally pursuing a legal and forensic degree at the master's level, or that's what I was interested in. I had taken an abnormal psychology course during my undergraduate studies, and that really won me over. And I just had this deep-seated desire to help those suffering from mental illness. And so that's really what got me interested in clinical psychology.
Excellent, fascinating. So why did you decide to go to Divine Mercy of all the schools of psychology out there? Why DMU?
Yeah. So yeah, when I was looking into graduate programs with that desire to help those overcome mental illness and suffering, I just remembered too that having attended public schools my whole life, as an adult, I really desired formation in a Catholic identity sense, and researching some of the religious programs out there, the PsyD and PhD programs that had a spiritual component to it. A close friend of mine mentioned Divine Mercy University and the trailblazing work that they were doing with the meta model, the Catholic Christian meta model of the human person. And I just felt that it was the perfect fit.
Fantastic. Yeah. I mean, those are very good reasons. I mean, that's the hallmark of our school, really. So then speak a little bit to you mentioned you have a military background prior to becoming interested in psychology, but say more about your own clinical interests and academic interests.
Sure. So it's evolved over the time I've been in the program, because really everything I've been introduced to by the wonderful faculty at Divine Mercy, they just have an infectious way of pulling you into what they're interested in and what we're exposed to, because there's not just a depth but a breadth of experience that you get at Divine Mercy University in the field of psychology, and also the philosophy and theology core. Personally, I have academic interest in anything impacting service members and veterans in terms of mental health, trauma specifically, perhaps even combat trauma and PTSD are interests of mine, and what I'm examining and exploring in my work with my dissertation. I've also done clinical work related to those topics while working at the VA, the Veterans Affairs Hospital. But then I've also developed a passion for serious mental illness and patients that require hospitalization due to the serious functional impairment of their disorders. So that's another passion of mine as well.
Yeah. Say a little bit more about your dissertation. What is your topic and who's your advisor?
Sure. My advisor is Dr. Philip Scrofani. And my topic is exploring the ways in which combat PTSD, combat trauma, and the combat PTSD as a result is qualitatively different than what we've kind of understood as just your simple PTSD. And so I'm really trying to make an argument that combat trauma in itself is inherently complex for a number of reasons. And so therefore, because it's complex, it requires a complex protocol to treat it successfully. And it's not a one-size-fits-all kind of approach, but it's going to take time and a different understanding than we've given it in the past.
So, surely the field of trauma is a massive field within psychology, no doubt. But it sounds like you're like, you have fairly fine-grained sort of approach. So you have you have combat trauma, and it sounds like you're distinguishing that from PTSD, and that's even further distinguished from, you might say, other forms of trauma that are non-military related. Is that fair?
Sure, it's fair. Although I'd be careful, in the way that I approach it. Anyway, there's no trauma is worse or greater than any other type of trauma. But I think that in the literature, there's in the upcoming literature too, between the DSM-5, which is in revision, and the ICD-11, there is clarification between trauma and complex trauma, or PTSD and complex PTSD. And I think that combat trauma and the factors that relate to it are inherently complex. And so we should look at it that way, and also treat it in that sense as well.
So it sounds like it wouldn't be accurate to say that you can simply put trauma on like a continuum of severity. Rather, they're qualitatively different, and so they legitimize a sort of a completely different approach depending on the situation. Is that accurate?
Yeah, perhaps there may be an objective or subjective continuum even, but I think one thing I've taken away from my time at DMU, it's meeting the patient or the client where they're at, and in terms of what they've suffered, and so I guess where if we're talking about a continuum, it's relative to the person. But I do think that there are certain aspects of trauma or someone's experience that can make it complex, such as feeling trapped in a combat zone versus experiencing a natural disaster, if you will. I think qualitatively that they can be seen as different. And a big part of my dissertation is witnessing that most of, if not all, of combat trauma is interpersonal. And what does that mean when we're talking about combat or war, and how that plays a part in the trauma that's experienced, and then the resulting disorder, be it PTSD.
Yeah. One thing it's in there, what you mentioned, the subjective nature of trauma. So it sounds like you could have, a event happen, say within battle, for example, and it impacting people differently. So perhaps like the same events might be variously impactful for different people. It's sort of, I assume that's sort of like an essential part of understanding trauma. Is that right?
Sure, absolutely. It's something that I think needs more attention. Like what we have as the field of psychology has looked into those I guess predisposing factors that might make someone more susceptible to developing PTSD following a battle, if you will. Because certainly not all veterans develop PTSD, but a lot of them, there's just a disparity between the general public and veterans as far as the presence or the resulting disorder after a trauma. So when compared to the general public, veterans are more likely to develop PTSD as a result of their service. And so examining that disparity, but also within, say, a unit that experiences a battle, what makes somebody more vulnerable to that? And does that also help inform that idea that combat is just more complex than, say, another form of trauma? not to say it's worse or different in one way or another, but I think that it's just inherently complex.
Would you say does personality play a factor in the way that people receive trauma? Is that at all an issue?
Sure. I would say so. I think if we look at personality as that intersection between the intellect and emotional capacities, which is, driven from our experience up and, through childhood and into adulthood, certainly some of those aspects would play a role in how we respond to trauma and overcome it. I think there are also just phenomenons where we don't quite understand why somebody with this personality or that personality may be more vulnerable than the next. But certainly I do think it plays a factor.
Okay, yeah, that's fascinating. Thank you for sharing that. You also mentioned your new interests. Your interests have kind of evolved over the course of your time here, but your interest in severe mental illness. What would be maybe a few of those that are of particular interest and one that you might want to become invested in later in your career?
Sure. I think it's hard to say one, but or just one, but I think generally speaking, I think those suffering from severe mental illness, which results in a hospitalization, I think there's a disparity between those that need mental health services and those that have access to it. And so I've noticed within the field that those that are hospitalized for a serious mental health crisis or disorder, the services are often limited. And so that's one of the things that draws me, one of the factors that draws me to work with that population. But among them, I think psychotic disorders, schizophrenia, is something that I find interesting and would like to work with individuals more suffering from delusions and hallucinations and that breach of reality, because I think oftentimes they're alienated, just anybody with serious mental illness, and I just found it to be an honor and a privilege to sit with those that are suffering from the worst day or week or month or years of their life, and I think that's just something that unfortunately is synonymous with the population of folks suffering from severe mental illness.
Sure. Again, very interesting. So let's circle back to the program in general. So to your mind, what are the most interesting, rewarding, delightful aspects of your experience here at Divine Mercy going through a program? And then what would be, to kind of take it in the other direction, what would be some of maybe the most challenging, maybe the most difficult parts of the program?
Sure. Well, I think the most delightful or enjoyable aspects of DMU, among many, for me have been the people, whether it's the staff or the faculty or my fellow students or colleagues. I think that it's a very enjoyable place to be. We can differ in some of our opinions, but I've found that everybody's respectful of that uniqueness that DMU not just portrays but informs through the CCMMP, and so they're living it out. And I think that's a very enjoyable aspect of the program is just being able to be yourself and be respected within the community here. It just makes sense too. It's nice to see a program that has a model and practices that. And I can't say that I've found that anywhere else. In fact, most of what I've heard about other students at practicum sites have been that there is just something qualitatively different about who we are as a student body when we show up for work. And I think it's an extension of that. That program and just the environment that DMU provides. Yeah.
Great. And then so like the other part, what are some of those difficult, trying, challenging aspects of the program for you?
Probably the most challenging is the work, and I don't think it's DMU specifically, but although there is an aspect at DMU that was difficult for me. So I mentioned that I attended public schools before, and that was one reason why I sought DMU out and felt that it was the perfect fit for me, is because I desired that formal education and formation within that Catholic identity or Christian identity.
Mhm.
And DMU offered that, but it felt like the PhD core was strenuous, because not only are we doing this, we're taking the courses that have the psychological emphasis, the clinical psychology courses, so statistics and personality theory, biological bases of human behavior, and all the theoretical courses, but tack on theology and philosophy for someone like me that hasn't ever had a background or a formation in that. And that was difficult for me, but certainly I think if I can make it through, anybody can. And they're so gentle when it comes to those things, and they really meet us where we're at in our formation when we arrive. And so I couldn't be happier about that.
Okay, good to hear that. Now, for those listening, so there are a whole swath of reasons why people might want to become clinical psychologists and thus enter into a PsyD program like our own. But what would, in your opinion, what would be maybe some really good quality reasons for wanting to do a doctoral program like our own? And then what would speak to maybe some not so good reasons, some reasons that are really kind of maybe not very well positioned for somebody that would do doctoral studies?
Okay, yeah, that's a great question. I think for those, what would be a very good reason for pursuing PsyD in general or at DMU is if you truly feel called to be an instrument of healing, and with that desiring a depth of knowledge in theory and practice, then PsyD would be a good fit. And DMU would offer a very robust program with those components, including administration, interpretation, and the ability to report with measures of psychological assessment to support diagnostic clarification, to inform treatment. I think those are the elements that DMU or just a PsyD would provide a student in their clinical training. And so those would be aspects for pursuing PsyD.
Okay, and then what would be some really awful, some really bad reasons for doing this?
I think generally speaking, I think prestige, if you're looking for the title, or you're just hoping to do therapy even, I don't know that a PsyD a degree in clinical psychology at the doctorate level would be a good fit. And again, generally speaking, if you're looking to amass a wealth financially, obtaining a PsyD probably isn't the best road to do that, a best path. I think it really comes back to the desire or the calling to be an instrument of healing.
Right. I mean, it sounds like, just to speak candidly, it's like you can financially, you can do quite well as a psychologist, but at the same time, it's not as if, if you're just out to make a killing, that this is a very smart course to do that. Is that right? Is that fair?
I'd say so. I think, you can find fully funded PhD programs with stipends if that's what you're after. But PsyD program, typically isn't fully funded, and I think the desire there should be more along the lines of what you'd be doing than any benefits monetarily. Sure.
Okay. Well, good. You kind of hit on you were talking about prestige and that being not a great reason, which kind of leads me to my next question about the major differences between psychology on the one hand and counseling on the other. both just in general, the scope of either, and then the types of people that might want to pursue one or the other. Because I mean, there's a lot of, I think it's fair to say that uh, that the role of a counselor and the role of a psychologist are often overlapping. But it's just not the case that the counselors receive the same training as a psychologist. So could you speak to that division?
Sure. I can certainly speak to my experience of it. I'm no expert in the counseling side, but I have encountered counselors in my clinical practice, and I think a major difference would be the depth of theoretical understanding that's provided through a doctorate in clinical psychology versus a counseling degree. I think, like you said, we're on the same team. There's a lot of overlap. I think that theory is one of those things where maybe depth is provided more to the doctorate level student psychologists than the counseling student. And then going back to, if you're interested in mastering and administering psychological assessment, that's really what doctors are known for. That's the major difference between a psychologist and a counselor, is that we can administer, interpret, and report on psychological assessment measures. And if you feel called to be able to do that and have that resource, that tool in your pocket, when conceptualizing a person and informing treatment, then becoming a psychologist with a doctorate is the route for you. Because I think, if I'm correct, counselors are limited in their ability to administer and interpret psychological assessment measures.
Right. So on that issue, though, I mean, with the testing, what are some of the most maybe the most prominent, the most commonly used assessments that a psychologist would employ on a regular basis?
Sure. So I think, just off the cuff, two major domains would be cognitive assessments. So say somebody unfortunately had a head injury and we wanted to look at their performance as it related to age and where they should be at with age-based norms, we could provide a cognitive assessment to determine if there are any deficits in cognition, to be able, again, for diagnostic clarity, what region of the brain was impacted by this blunt force trauma, and how do we treat that? What tools do we have to treat that specifically or holistically, in the sense of TBI, because it can also be, it can be profound deficits. Or the other is personality, and so how we can do personality testing, or we can do a full battery and get a good idea of the whole person through cognitive and personality testing to inform treatment. There's also ADHD testing and other things that we can perform for diagnostic clarity, so that individuals get services and treatment that's very specific to the suffering or the goals that they would like to accomplish in therapy.
Yeah. So it sounds like, especially like considering things like personality tests, for example, that you can get a lot of really good information about the personality makeup of somebody and what they tend toward, whether they're more neurotic or they're more open or what have you. In one of these tests, whereas like that could take some time for maybe talk therapy to unfold. Is that fair?
Sure, absolutely. I think assessment can oftentimes give that swath of information that you mentioned, inform treatment, and so that we can hit the ground running. And validate what someone may be experiencing, and yeah, I think it's a great resource that we have as psychologists to be able to aid in not just diagnosing, but the treatment as well.
Yeah. Recently we had on Dr. Garrett Boyer, a recent alumnus of our PsyD program. He mentioned one of the more prominent or popular of these tests is the Big Five. I think I forget he mentioned all of them, and I've forgotten them, but Is there another similar test that is similarly common that also does personality?
Sure. Yeah, the MMPI and the PAI are two uh, extensive personality measures that we provide, and give much more than just the Big Five, the OCEAN acronym of symptoms. And so those tests, yeah, they're lengthy but extensive and provide robust data so that we can interpret and provide feedback for the patients that we work with. And really, I'd say we at DMU especially, we look at it as a starting point. It's not a one size fits all resource. We take it as a data point because we can't reduce somebody to say just their personality or just perhaps one aspect of the OCEAN acronym, the Big Five. And so personality measures can give us insight, but we interpret sometimes with caution, especially if it's not clear, but certainly informative nonetheless.
Okay. No, this is new to me. I didn't know about the OCEAN thing. So let's see if I can get this. So O is openness.
Mm-hmm.
C.
I'm not an expert on this one, but
Okay.
yeah.
This all sounds really familiar to me. I think E I guess would be extroversion, introversion. A would be agreeableness and neuroticism, I think.
Mm-hmm. I think going back to conscientiousness is.
Oh, conscientiousness, right on. Okay, gotcha. Okay, that's really good, fascinating stuff. All right, so then on a theoretical level, though, what would be maybe one or two or three of the most formative ideas for you that you've learned here as a doctoral student at DMU that have been most impactful for you as a therapist and an emerging psychologist?
Sure. So one of the most formative ideas that was provided or taught, and I think more in essence, certainly we've talked about it specifically, but this idea that we as individuals, we all have inherent dignity and self-worth, and we ought not to reduce somebody to what's wrong. And so it's important to identify, perhaps even label in a diagnosis or a diagnostic sense, that what is a disorder, but two, so with that, I think we shouldn't reduce a person to that. So in one of the ways that I've grown as a person, but also a psychology student, is that I also should emphasize a person's strengths. And one way we do that at DMU is we examine virtue and how individuals flourish in a virtuous sense. And so it doesn't just have to be about languishing. It's really, how do we get this individual to flourish with perhaps a diagnosis of a psychological disorder, but they're more than just that. And I think that inherent dignity that a person possesses is something formative that I'll it's the lens in which I look at individuals that I work with, or anybody really, and I think that's profound.
Yeah, and it sounds like this business of human dignity, it's like securely and rigorously backed up by our Catholic anthropology, right? I mean, seeing the human person as made in God's image and likeness, it provides, you might say, philosophical teeth for an idea that is often kind of imitated by a lot of people in our secular society, but maybe without as a rigorous and a philosophical underpinning as to why it is that we should value, the human person, regardless of all the things that you meant, pathologies or social status or anything like that. Would you say that it's fair?
Yeah, right on point.
Okay, well, great. And then, excuse me. And then in terms of, we speak a lot at Divine Mercy about the meta model of the human person, and surely, as we've said, you've had courses in philosophy and theology. How would you say, what if you could maybe summarize what practical or applied difference this makes within a clinical setting? Because this is a common question people want to know. It's like, well, okay, so it's great that you're Catholic and I'm going to get formed in this meta model. It's just the unique aspect of Divine Mercy, but what actual difference could that make, or would that make within a clinical situation?
Sure. That's a great question. I think practically, what we're talking about is integration, and so when we look at a whole person and we integrate the parts, and going back to one of my clinical interests, we talk about trauma, whether it's, I mentioned traumatic brain injury, but also interpersonal trauma. Two different types of trauma there. I think if we integrate what that means for the person and how it impacts other aspects of their personhood, the different dimensions of the person, if you will, it's integration. It's what we call integration, and we get a much better sense of who the individual is. And again, not just their languishing, but their strengths. And we can harness those strengths in treatment. And I think that goes a much longer way than just focusing on the problems. And so, there are a number of protocols out there, psychological or therapeutic protocols that do that well. And they're it's more of the I think up and coming or just recently established protocols, motivational interviewing or positive psychology or interpersonal therapy, that really use those aspects of the person in a way that just makes sense.
Yeah.
And so it doesn't reduce the person to, again, their suffering or the disorder, but uses multiple domains across their personhood to really understand the person in front of them. And I think it's a practical, it just makes sense, and it's something that DMU does exceptionally well.
Yeah, it sounds like the way that you mentioned a couple of therapeutic modalities. Would you argue that there are certain, like, once you get yourself into the PsyD program, you're probably going to get exposed to lots of different therapeutic modalities, CBT, psychodynamic, existential humanistic strengths. You spoke a number of times to strengths-based psychotherapy. Would you say that in general, there are certain therapeutic modalities that are more fitted to the meta model than others on average?
That's a great question. I think, I guess generally speaking, the ones that don't reduce a person. So I think some older therapies that say behavioral based, if we reduce somebody to just their behavior, we miss so much of who that person is.
Yeah.
What's driving that behavior. If we look at them dynamically, and we look at, in so much as we look at their relationships and how, the term object relations is in that psychodynamic theory.
Mm-hmm.
If we look at how they've related to the primary caregivers, for instance, through an attachment lens too, we see why someone may have developed a pattern of behavior that becomes maladaptive. And so it's not so much reducing them just to that current behavior, but if we look at them holistically over time too, we get a much better sense of what we're working with. And I think if we do that and we integrate those parts of a person in their experiences, and also to keep in mind that they have volition and we're working for them. They have goals they'd like to accomplish too, and we're keeping them apprised of the diagnosis or the treatment modality, but keeping them as an active speaker in what we're doing. I think that works. And I think so any orientation or any modality that doesn't reduce a person to just one aspect of self is working with the meta model or factoring in a holistic view of the person, which the meta model does.
Yeah. You mentioned so like the behavioral, also dynamic. So it sounds like that's dovetailing with psychodynamic psychotherapy. And you also mentioned attachment. Is it the case that attachment is an element of psychodynamic theory more broadly? Is that fair?
Sure. Yeah, I would say so. attachment theory. Mhm.
Yeah, okay. And the other thing I noticed is, the way you spoke to the different parts of the person and how these the parts can be integrated, or at least they should be sort of ideally integrated to live a flourishing life. It reminded me a lot of Dick Schwartz's IFS. Are you familiar with
Yeah,
internal family systems at
a
all?
little bit. I sure am. Yeah.
Yeah, and just like the idea that, people are complicated and they have lots of different elements, and different parts of us kind of can diverge in different directions, but that, that we have a sort of a center, the sort of like the deepest part of ourselves where we can kind of come together and flourish. Okay, good.
Absolutely.
Yeah.
Yeah.
Now, look, I want to talk a little bit about your internship. Now, I think that you are on the cusp of entering into your internship year. Could you say a little bit about where you're doing internship and what's it about and what to expect?
Sure. Yeah, absolutely. So in July, I'll be beginning my internship at the DC Veterans Affairs Medical Center. So I matched with them, and they have a generalist model. So I'll be doing 3-4 month major rotations there. And I get to have an active voice and, in that, and hopefully that I'll match with the rotations that I want, because they're major clinical interests of mine. And they include the trauma services program clinic, which is the premier clinic for treating severe PTSD there at the DCVA. The neuropsych clinic that does cognitive assessment for TBIs and other mental health reasons, maybe pre-surgery consults there at the DCVA, and then also to the psychosocial rehabilitation program, which works with individuals suffering from severe mental illness on the following hospitalization. And so they have a chronic serious mental illness and are enrolled in a program that supports them after they've left the hospital. And so I'll be doing those 3 rotations, hopefully. And of course, all with veterans. The patient population there are men and women from any generation of military service, really, from Vietnam, the current Gulf War, or the current war on terror.
Yeah, it sounds like this internship is hitting all the William Johnston major interest points. Is that right?
It is, and the nice thing about it is we didn't have to move. I didn't have to pick up a family of 7 and take them across the country. So it works out for a number of reasons, clinically and then personal too. So yeah, couldn't be happier.
Awesome, good. All right. And also, I mean, for those listening, correct me if I have this wrong, William, but it's to my knowledge, we had 100% of our students get placed into APA accredited internship sites this year and also the year before. And that we as an institution require our doctoral students in their 4th year when they're applying for 5th year residency or into internships to apply to APA program. Is that right?
Yes, that's correct. All those accounts. I think our program has done very well matching, and I think that's just a testament to what DMU offers. Through our academic training, but too, then how we're formed and show up at these clinical placements throughout our time in the program prior to going off on internship. I just think that's the results of the last couple of years is a testament to that. And so it's quite rewarding to be part of this.
Sure. And what for those that are kind of new to exploring this, what would be the upshot of getting into an APA, not just an APA school, but getting into an APA internship site?
Sure. So my understanding is that licensure is easier. If you want to work for the federal government, they require that you have interned at a APA accredited site. And so having not done that, you wouldn't be employable by the federal government, at least right now, because that's their standard. But I think, being that the APA is the accrediting body for clinical psychology programs in the country, it's kind of the standard that employers look at as far as education and training. And so I think it just makes everything easier following the degree process, licensure, and employment.
Yeah, makes sense. I mean, it sounds like similar reasons why, the attraction and the efficacy of getting into an APA accredited school in the first place. I think to what I understand, it's like that serves a similar purpose. Good. Now, William, last question,
Okay.
and then you'll be off the hot seat for a bit.
All
So you're a family man, you're married, and you have a number of children. Say something about your experience here, being married, having children, and how you've managed that with a very rigorous, demanding, full-time, year-round doctoral program.
Yeah. Well, I think most of the credit goes to my wife. she's an all-star, and I think communication was a big part of that. So discussing that calling and what it would mean to go through a program, and in my case, I added an additional year prior to internship for a number of reasons, but just keeping that line of communication open, and what the program may entail, because it's laid out in the program handbook, which I think prospective students have access to, or the kind of the trajectory, if you will, of what the program is or looks like on a typical basis or an atypical basis. And so you can really see what you're going to encounter here, and surely things arise, but I think in my situation, I think just communicating what that calling meant and what it would mean for our family, and and the difficulties that are inherent in graduate school and clinical training, and so I think that would be my one takeaway is talk about it, and discuss it with your spouse if you're interested in taking a family through this roller coaster of an experience. But if I can do it, I think anybody can do it.
Fair enough. Very good. All right. Well said. Let's segue into the PowerPoint section. So bear with me as I share my screen with everybody. Okay, so as I go through this, everybody, if you have questions that have arise in your minds, please lodge them in the chat box, where me and William and I can attend to them at the end. So without further ado, this is the overview of the doctoral program in clinical psychology here at Divine Mercy University. So Divine Mercy is a Catholic graduate school of psychology. It was founded in 1999 as the Institute of Psychological Sciences and dedicated to the scientific study of psychology with a Catholic Christian understanding of the person, marriage, and family. Its expansion from IPS to DMU occurred in 2016 to facilitate growth and to add a counseling program at the graduate level. So we're one university with two distinct schools: the School of Counseling, which offers a master's program chiefly online, though there is a hybrid component in the sense that our counseling students do come to campus episodically for clinical reasons, and the Institute of Psychological Sciences, which houses both a residential doctorate, which is what we're talking about right now, and the master's in psych, which is entirely online. Our mission is to provide students with an effective academic and educational environment that supports the integration of the psychological sciences and a Catholic Christian understanding of the person through teaching and learning both knowledge and critical skills. Also to assist students intellectually and professionally as they prepare themselves to respond to their vocation as mental health professionals. So we're located, Divine Mercy is located in Washington, D.C., which is, I should say actually outside of Washington, D.C. in Sterling, Virginia. So we're not too far from the big city. If you are a city person and you like the city life, the scene of the arts and culture that a city would provide people. On the other hand, if you're more of an outdoorsy sort of a person, we have that on offer as well. To the west, the Appalachian Trail, which, as you may know, running from Maine to Georgia, is sort of coast of the western side of Virginia and West Virginia and Maryland here. So hiking, canoeing, whitewater rafting are all here as well. So it's Truly, I mean, I should say, granted, I'm biased being a native of this area, but despite that, it's really a great place to live and work and study. William, have you found that to be the case? Am I exaggerating, or is that?
No, I think there's a little bit of everything for just about anyone that comes to the area. So you can, yeah.
Good. Divine Mercy University has a number of accreditations. So beginning with SACS accreditation, the Southern Association of Colleges and Schools, which is recognized as an accreditation agency by the Department of Education. And DMU has voluntarily participated in this accreditation process and met or exceeded all standards and thorough evaluation. We're also approved to operate by SCHEV, the State Council of Higher Education in Virginia, and the PsyD program has been recognized since 2006 as a National Registered Designation Program by the Association of State Professional Psychology Boards. And as we've been mentioning here and there, Divine Mercy is APA accredited, so American Psychological Association accredited since 2016. And we've also been approved to participate in the National Council for State Authorization of Reciprocity Agreements. So we're thoroughly and utterly accredited in every possible way. So as a therapist or practitioner, you would be, especially as an emerging psychologist, you would be able to perform assessments and testing, journeying with your clients toward flourishing and healing. And as William had noted, this is really you might say, a hallmark of clinical psychology, namely the training that you will receive as in testing and assessment and things of this nature. It plays a really central role in our curriculum. Okay, this slide offers a broad overview of the 5 years of the program. It is 122 hours all told, which does include a master's in psychology degree in passing en route to the doctorate. And we should distinguish that the MPsy degree, which William has recently received from us being part of the PsyD program, is distinct from the MSP program, which is an entirely separate non-clinical online program, but our own doctoral students and candidates first receive MPsy degrees en route to the doctorate. Anyway, over the course of the first 2 years, the main task is these core classes in psychological science, as well as the philosophy and theology courses as well. In the first semester, it is probably a good idea for people to start thinking about your dissertation. In the second year, for instance, we have a dissertation methods course where students are able to explore their dissertation and the different methods of research that would be fitting for them to explore. In year 2, your coursework does continue, though you have your first foray into your work as a clinician, because you will see a handful of patients, mostly on our on-campus clinic here in Sterling. And then once you get into years 3 and 4, the program shifts somewhat in the sense that you have somewhat less courses on the academic side, but more time spent with patients on local clinics in the area. And then finally in year 5, as William had mentioned, the internship. And so he has one that's local in DC, but these are internships to which you can apply in virtually anywhere in the country, depending on your psychological specialty. You really want to find a good fit. The word he uses, match, and that's similar to physicians getting matched into a residency program. So too with clinical psychologists getting matched into appropriate internship sites in your field of specialty, whether that be severe mental illness, psychosis, schizophrenia, or trauma in the case of William with PTSD and combat veterans. And then, as we mentioned, we had perfect placement into APA sites this year and the year before that. So you getting into an APA site is extremely likely. William, is there something that I've missed here that you might want to speak to?
No, I think you've covered just about everything. I think there is clinical training throughout the program. So starting in year 2 of the program, you would be in the in-house, the IPS Center for Psychological Services, and getting clinical training with a supervisor at DMU. Mm-hmm. And then years 3 and 4, you're at external sites, and there's a long list of sites that are available to us as students to work at. And so there's this site or this area is a really good area for just about anybody pursuing their niche in the field of psychology, because there's, just as there is, when we're talking about the outdoors or food, that as far as clinical training goes, there's something for everyone here. And so seeking a PsyD at DMU offers you, by extension, access to those sites for clinical training. And it sets you up for that internship year. So you're gaining clinical experience at these different sites, trying to form your specialty or your background in these different subfields of psychology to set you up for internship and beyond. And that, yeah, it's a very good area for that.
Good. Are you supervised by DMU faculty in years 3 and 4 for your clinical work?
No, you would be supervised with a supervisor at the respective site you're at.
Okay.
So
Gotcha.
I was at the DCVA this last year, and I was supervised by a clinician there, a psychologist there.
Okay, that's helpful. That's good to know. Okay. Now, is the PsyD program right for you? Here's a few questions of discernment. Okay, so do you want to help people flourish? Are you interested in the science behind human behavior? Do you want to become an instrument of healing through the psychological sciences? Are you interested in performing psychological tests and assessments to diagnose your clients and create a treatment plan? Are you looking to start a career as a licensed mental health professional and specifically as a clinical psychologist? And do you have the ability and desire to work with all types of clients, from acute care to more challenging and long-term cases? So if you're reading this and you're hearing this and you're thinking, well, yes, certainly for all these, yes, then this is probably a good fit for you. There are a number of areas of competency that we do aim to inculcate over the course of the 5 years in our students: foundations in psychological science and research, integrity in practice, assessment and diagnosis, therapeutic intervention, professional roles in clinical practice from a Catholic and integrative perspective. I'll go through each of these in turn in more detail. First, foundations in psychological science and research. Graduates will obtain foundational psychological science knowledge of biological, cognitive, affective, social, and developmental aspects of the human person, as well as history and systems of psychology, psychological measurements, research design, and statistical method. Graduates will have the skills necessary to conduct their own psychological research. 2, integrity in practice. Graduates will be knowledgeable in the areas of diversity and ethics and display critical thinking, self-aware and reflective practice, and self-care. Graduates will demonstrate responsiveness to supervision, collegiality, and professional concordance in professional practice. 3, assessment and diagnosis. Graduates will be able to conduct clinical interviewing, perform intake evaluation, demonstrate knowledge in the administration, scoring, and interpretation of psychological assessments, integrate multiple sources of test data and clinical interview information into a written report, diagnose and develop a treatment plan. 4 is therapeutic intervention. Graduates will be able to demonstrate case conceptualization, treatment planning, building and maintaining a therapeutic relationship, psychotherapy skills, crisis management of urgent and special circumstances, and discharge planning. 5, professional roles. Graduates will be able to function a variety of required roles for professional psychologists, to include consultant, educator, supervisor, practice manager, and program evaluator. They'll be able to work collaboratively within disciplinary teams and clients. And then 6, clinical practice from a Catholic and integrative perspective. Graduates will have developed a Catholic understanding of human flourishing in the individual person and marriage and family life, and be able to integrate this with psychological sciences in clinical practice. So as you are probably aware, clinical psychology is a massively diverse field, getting into so many different areas in which one could become ensconced within or an expert in. So in the interest of time and our purposes here, I do want to say that the main task of the program is to get you licensed as a clinical psychologist. The process that William himself is moving toward very soon. And then also to kind of keep in mind the unique opportunities that getting a PsyD will allow to you. For instance, taking up a leadership, the helm of leadership in a clinic, say, or getting placed in a hospital, working alongside psychiatrists in the traditional medical establishment would also be on offer should you want to go down that route. We've had legions of students come through our school and enjoy a great deal of success here at school and go on to flourish as clinical psychologists. And so there's so many alumni have said good things about us, but these are just a few of them. James Bolovich has said in our clinical psychology program, the training is focused on healing the whole person. Kristen Long, I was drawn to the PsyD program out of a desire to serve others in a more profound way than my previous positions offered. Timothy White, this school is not afraid to teach you what it means to be human at every level. Psychologically, philosophically, and theologically, that's why I like it. And then Kirsten Curtis, I'm so thankful for TMU. The faculty members are very supportive, and I receive lots of hands-on clinical experience. This guy looks familiar. So here's William Johnston. This video was taken, he was a third year, but he's moved on in our program, and so this is his testimonial from not too long ago.
Hi, my name is William Johnston, and I'm a PsyD student at Divine Mercy University, currently approaching the end of my third year in the program. Military service runs in my family, and so both my grandparents served, my parents both served. This door, the PsyD program at Divine Mercy University, opened that opportunity for me to continue to give back, to conduct research, and hopefully implement a more robust program to treat PTSD as it relates to combat veterans. DMU has certainly provided the integration that I've sought in terms of my formation, both the philosophy and theology core, in addition to the psychology curriculum, has provided me growth in terms of my faith and my role as a husband and father, and of course a psychological clinician. So in essence, the Catholic Christian meta model of the human person is why I'm here, both for my own sake as well as the sake of my future clients.
All right, very good. This is another video testimonial from a recently graduated alumna.
I would say that being a student at Divine Mercy University, or DMU, is one of the best things that happens to me. I really appreciate a great support from faculty members and also classmates. I have gained a great deal of knowledge in all aspects of clinical practice, research, and also professional development. DMU not only provides students with strong academic skills, but also prepares them for a career in psychology. I personally benefit from mentorship with academic advisor and clinical supervisors. As a person, what I most appreciate from DMU is that its mission helped broaden my perspectives in understanding a human person through the lens of Catholicism. Catholic principles, especially in hope, love, and faith, are very valuable and certainly helped me become a better clinician.
All right. So we offer a generalist program in psychology here at Divine Mercy University, which means that we have faculty with expertise ranging the full spectrum of the psychological sciences, everything from developmental psychology, personality psychology, social psychology, different areas of neuroscience. So these are a few of many different professors here. Dr. Klawacki is our dean, IPS dean and program director. She's an expert in adolescent, adult, and couples therapy. Dr. Gray is the assistant program director, is a specialist in child developmental psychology. Dr. Picaroro is a specialist in addiction trauma. These three gentlemen here at the bottom were among the founding faculty members of our school back in 1999. Dr. Scrifani specializing in CBT and group therapy, Dr. Nordling in child, marriage, and family therapy. And Dr. Witzesberg is really, to my mind, very central to our mission and our theoretical, our conception of the meta model. His work being sort of situated at the nexus between Catholic theology on the one hand and modern psychology on the other. William, is there anything else to mention about sort of the makeup of the faculty for those who are joining us here?
No, I think it's well-rounded in theory and practice. And so coming to DMU, I wouldn't say you're going to find one size fits all essence. I think the clinicians that make up the faculty here have a wide variety of backgrounds, a very diverse array of backgrounds that can provide consultation or supervision in the case of the clinic for just about anybody in their interest in the field of psychology. So I couldn't have been more pleased with the experiences that that the faculty make up and provide us as students. So
Okay, very good.
yeah, it's great.
In terms of licensing, so first, is license required? Yes, certainly licensed practices required by any state or jurisdiction where you might practice as a psychologist. When licensing begins after the student completes the practicum and internship and officially graduates from DMU, states can and often do have additional and different requirements. So students are responsible for checking state requirements where they plan to work and adhere to them. And these typically do include national and state exams. Divine Mercy will provide general information related to licensure during the student experience. Who initiates licensing? Licensing is a student-driven process, so it is important for the student to research licensing requirements in the state that he or she intends to work in as early in the program as possible. And will students be fully licensed after graduation? No, graduates must work about a year in a supervised clinical environment in addition to other state requirements to be licensed. And the graduate may be required to obtain a provisional license for this year period, so be sure to check your state for requirements. Now, these two graphs depict a distinction I like to draw between investing in or really buying something purely material, like say a car, where the value of that car is very likely to diminish or depreciate in value rapidly after its purchase. Whereas contrasting that for a moment with a investment in yourself and through education, where, and especially a field like psychology, one that is so very much in demand in our modern world, where so many people find themselves alone and depressed and anxious. So they suffer from trauma of all kinds, broken attachments from youth and things of this nature, where they very dearly need a therapist, a clinician like William and others and his colleagues to really enter into their suffering and provide healing where there's a lot of dire need for it. So it's an investment in yourself, but also in the good of other people, but one that will of course be remunerated over the course of your career. It's a value that appreciates. It does precisely the opposite of the car investment. It grows in its value as you become more and more experts in the value that you can provide others over the course of your career. The investment itself is 1,170 per credit for 122 credits. So over 5 years is 142,740. That does not include indirect expenses such as housing, gas, food, things of that nature. Typically, students do pay for their education through different loans and grants from the government. And once you submit your online application, the financial aid office here will get in touch with you to help work you through that process. We also offer a number of ways of defraying the costs for students, such as work study, scholarships that are available sort of at different places in your time here as students. For Catholic students, we offer something called diocesan investment. It's basically a discount for being an active member in your parish, and it does require a letter from your parish indicating that you are in fact a member in good standing, and so as a way to verify that. And this will often mean 15% off of total tuition, which is helpful. We also offer a slew of different scholarships. They are applicable to different demographics. So to glean more information on them, I would definitely take a look at our website, divinemercy.edu/financial aid, and this will explain, all the, what is required for application to these scholarships. Typically, it does require a brief essay, and they pay out up to the amount indicated here to the right. I would also add that we offer a number of merit scholarships to top candidates in the admissions process. So if you have a GPA usually higher than, well, I should say maybe 3.5 or higher, you're probably competitive for one of these scholarships. The other thing to say is doing well in the GRE is also helpful in obtaining a merit scholarship. So that, I hope, offers a good account of what we offer students to help bring the cost down. In terms of entrance requirements, we do require a baccalaureate degree from a regionally accredited school. Now, we also don't require students to have studied psychology formally before beginning a doctoral program. If you have, this is certainly advantageous, and we even encourage it. It's preferred. But we've had students come to our school and they've succeeded from any number of different backgrounds, from the hard sciences to the humanities and arts and everything in between. We do also require, now I should, one sort of caveat to add to that, however, is that if you lack on, any psychology background or whatever, we will probably require you to take a prerequisite class over the course of the first year. It is an online course, so it's really what it is in its essence is an undergraduate introductory course in psychology that's spread out over 2 semesters in the course of the first year. It's right now it's being taught by Dr. Rebecca Morse, and I've spoken to her about this a few times, and to her mind, it's pretty straightforward class, one that shouldn't cause too much problem for people juggling their other coursework in the first year. We do require typically a 3.0 GPA and a 4.0 scale. If your undergraduate GPA was somewhat less than that, let's just say that you had a 2.8, 2.9, something of that nature. Please don't count yourself out, immediately. Please talk to me, get in touch with me, email me, get in my Calendly books, and we can talk about it. It might not be immediately disqualifying, so please, if that's you, we can get in touch with me and we can chat about going forward regardless, despite that. Now, in terms of the application process is as follows. The first step is, provided that you feel ready to apply and this makes sense to you, please submit your application online. And that's a fairly straightforward process. It's on, if you go to our website, there's a big sort of button on the upper right hand side, and it says apply. If you smash that, it will avail the different programs in their application. And if you hit on the PsyD, the application will manifest itself, and then you can sort of begin the online portion. Now, once the online portion is submitted, the financial aid office will get in touch with you to help work you through those elements, and then we do maintain communication thereafter, such that to garner in all of the other elements of the application. And then once we have them all, you'll be provided that your application is strong, you'll be invited to an interview. And we do have an upcoming interview, the first of the submission cycle coming up in November, on November 10th. So here we are, moving toward the end of June. So this is an interview that's very popular for a couple of reasons. The first is that we offer an early admission scholarship, meaning that provided that you get your application in before this deadline, October 25th, you're eligible for $3,000 off of your first years of tuition. Moreover, it's competitive because we typically offer or dole out more of the merit scholarships to candidates in this interview in November. So for all those reasons, it would be to your advantage to get your application materials in sooner rather than later, so in order to secure a place in the interview. And I should also say, it is an on-campus interview, so we want to see you here in the flesh, and our faculty will conduct the interviews, and they're often group interviews, so you'll be in rooms with a couple of other candidates. So that's how that works. Now, once the online application is submitted, it does include a $55 fee. The following elements are required for the application to be complete. Okay, so the first thing is the essays. There's 2 essays. First asks about why you're interested in Divine Mercy and why you want to be a clinical psychologist. And the second asks about your academic and your clinical interests. So speaking to those 2 points is important. The other thing is we will need your updated resume. So what are your professional resume as it stands now will need to be submitted, and then recommendations. Now, the online application will ask for 3 recommenders. What we're asking for there is 2 professors, like 2 academics, ideally. Someone who can speak to your, promise as a graduate student, haven't seen you and observed you as an undergraduate, perhaps, or even as if you hold graduate degrees, that same thing applies. And then the third should be a work supervisor of some kind, someone who's observed you in a professional setting. Now, if you, let's just say on the one, let's take the two, say, extreme examples. Let's say you're still an undergraduate and you have no real substantial work experience. It's okay if you have 3 academic recommendations. That's totally fine. In fact, our dean, Dr. Cloakey, even might prefer that. So academic recommendations are great. Now, let's say you're on the other sort of side of things. You've been out of undergrad for many, many years and you don't have any contacts with any of your professors. Fear not, it's okay. Just be sure to find 3 work supervisors who can speak to your abilities, your work ethic, your professionalism, and how you might fare as a graduate student of psychology. And now we also do need your official transcripts. So, if you have undergraduate degree, we'll need that. If you have graduate degrees, we'll need those as well. And then the GRE. So I did mention the GRE earlier in the presentation. It is required regardless, and we do not admit, does not admit of exceptions. Every student who applies to the PsyD program, for their application to be considered, we need to have had received the GRE score, and this is simply not negotiable. So please take the time to do it. It doesn't have to be done perfectly. The GRE is not the end all be all in the admissions process, but it is required. So it's better to get it done than to have it done perfectly. So it's better to show up to the test and do your best than it is to study for it for 7 months or something, and then maybe you do great, but then the admission cycle is over. And so the idea being is that get it done, don't delay, and you can move on with the application. Okay, if you are an international student, please note the following. If you hold a degree outside of the US, you do need to submit your transcript for a NACIS approved evaluation service, such as west.org. So this will offer us a course-by-course evaluation of your transcript, as foreign degrees don't have the same grading scale as we do. So this helps us to see what it means in the American sort of schematic of understanding grades. And then, of course, it will have the degree that you've earned elsewhere should be the equivalent of an American bachelor's degree. And if it isn't in English, it will have to be translated into English. And of course, the cost of this is your responsibility. If English is not your primary language, and by that I mean this: if English is not the language that you mostly use to communicate with on a personal and professional basis, then you will have to take the TOEFL test or the IELTS academic test. So if you're an international student, if you have questions about this, please get in touch with me, and I can explain this to you in more detail if needed. All right, that's it. That's all we have. I do want to see. It doesn't look like we have any questions as far as I can tell. Good. With that, William, I do thank you very much for joining me today, and for all of your assistance and all of your wealth of knowledge that I regard as very helpful for getting people the info they need to make a wise decision about this program. So thank you.
Okay. My pleasure. Thank you for having me.
Okay, with that, let's conclude, let's wrap up, and I wish you all the best. If you do have questions about the program, please get in touch with me. I've left my Calendly link as well as my email in the chat box. So get in touch with me. I'm always happy to talk to students. With that, goodbye and God bless you all.